about the sun all the time. What's your thought on that? I always wonder if it's a double-edged sword. What dermatologists really feel about just go and sunbath and get rid of your psoriasis that way?
Well, of course, many dermatologists have what are called light booths, which seems like heretical for a dermatologist to have a ultraviolet light booth when we're spending all our time teaching about sun protection. I do not recommend sun exposure as a main treatment, even though it has been done. The sun does quiet down inflammatory mediators. It does decrease inflammation, so I can understand why it's being used. But the thing I'd probably want patients to know with psoriasis and eczema, but particularly with psoriasis, is that there is an increased risk of skin cancers in patients with psoriasis. So going out there and getting a lot of UV light in especially type 1 to 3 skin, but not only, but especially in that type, I probably would not recommend going out there as sun as a primary treatment. That being said, many derms still use their light boxes. I do not.
Okay. So do you still have the risk, and excuse my ignorance, do you still have the same risk? I kind of assume that you guys must have filtered out the bad UV lights before you start putting patients on that.
Well, there's a narrow band.
Still the same is it the same risk as just out there in the sun all day?
I'm not sure I'm understanding your question. The light that the narrow band UVB, so it's a very narrow band that's considered safer. Nonetheless, I have seen skin cancers look just like a psoriatic plaque in a patient with psoriasis that just isn't really responding to treatment, and you do a biopsy and it turns out to be a squamous cell. So I personally, my view is let's not tempt fate and make it more complicated. That being said, many derms still use their light boxes, but I choose not to.
Okay, so it sounds like it's safer. The limited band is safer than just sitting in the sun all day, but it's not perfect because there already is this additional risk of malignancies, of skin cancers if you have psoriasis, period. And you can just keep treating the same thing, not realizing that, hey, this is actually squamous cell cancer or some other cancer.
That's exactly how I feel. But others, that's how I feel. Yeah.
Well, we're asking for your opinion. When we want their opinion, we're gonna ask them.
Fair.
Okay.